Chamber Connection. I'm your host, President and CEO Mike Evans, and I'm joined today by Dr. Brian O'Leary, MD, and Vice President of the DuPage Medical Group. Dr. O'Leary, thank you for joining me this morning.
Oh, good morning. It's a pleasure to be here.
Tell me a little bit about DuPage Medical Group. We were joking a little bit earlier that I said I think 10 years ago it was like a small office practice down the street that people went to, and today you got office buildings and you're almost a full center clinic. It would appear a hospital in itself. So what has happened, and tell me about the exciting growth?
Well, you know, I think you hit it exactly right. It's been about 30 to 40 year growth for the group. We started as three distinct smaller organizations that came together in 1999. Our initial membership was about 110 physicians at about 20 locations.
Dr. O'Leary, that's great to hear about the growth. How many locations do you have to be that physician practice down the street?
Well, currently we have 55, and our expectation is that we'll have more as years go by. Our philosophy has been to try to be where our patients are. So we have a scattered site design, and I think to many people we look like the office down the street. There are just many offices down many streets. And in the last 10 years we've had the opportunity to grow to a group that is now over 400 physicians with 80 locations. Some of them are large hubs like our Lisle or our Glen Ellen or our Naperville facility, where we will have everything from PET scanning and MRIs to laser therapy for skin diseases. We just opened up a full-service cancer center in Lisle.
Absolutely,
and
yeah.
so,
and that's a beautiful facility. You see it right there off 88 as you're driving in.
Yes, yeah, we're proud of it. And it's really been a story of trying to find ways to engage the patients where they need to be and when they need to be.
Yeah. You know, healthcare is always an exciting industry. We are watching changes made every day, of course, both in technology and modern sciences, as well as the legal framework that healthcare has to operate in. How does all that factor into DuPage Medical Group? How do you stay competitive and plan that into your growth and strategy?
Well, I think at the board level and with our senior non-physician leaders, we sit down 2 or 3 times a year and try to look 5 years down the road and really get input from outside experts about what the legislative landscape looks like, what the economic landscape looks like, and what...
and your experts know that? Because maybe if you could share them with the rest of the state, there's a lot of other businesses that are trying to figure those landscapes out too.
Well, so. I do want to emphasize the word try.
We're trying.
We try.
Okay, good.
It's like practice, right? We try to do our best to see what we will need to be able to fulfill the mission, and the mission is meet the patient in their time of need and be the best healthcare provider in the area.
Well, and I think what you said is absolutely right. To any good growth strategy, and it's a brilliant model, to be where our patients are, so that healthcare has to continue to be accessible. We hear that word used a lot, of course.
Absolutely.
And there's another great member of ours that has a similar model in their industry in banking, and that's the Wintrust family. Be where our clients are, be where our customers are, and using that model. We want to get into a little bit about some of the new things happening with the DMG group over there. Let's talk about the Breakthrough Care Center. What is it? Who's it targeting? And whose idea was this to really move forward?
Breakthrough Care came from that strategy, vision, set of meetings that we've done over the last couple of years on the one hand, and on the other hand from our primary care physicians primarily, who have been frustrated over the last 15 to 20 years with seeing their inability to deliver the kinds of services that a fragile group of patients with multiple complex disease states, such as diabetes and heart failure and emphysema, coupled with social circumstances like isolation or lack of transportation or financial hardship or low medical literacy. And in that population, there are so many barriers to finding your way from ill health to engagement in your life and family and avoidance of pretty unpleasant things like hospitalizations, ER visits, expensive medications. So as we grappled with how to do that, and we looked at models across the country, and we found that there are some really interesting ones, but there isn't much where people tackle this. And we felt that as a multi-specialty group with many sites, we had the wherewithal to take this on.
Sure. Especially, we hear all the time in healthcare, and I've had the pleasure of sitting on some foundation boards out there. those patients are often the hardest to serve. The folks who need healthcare the most are typically the hardest to serve, to get them in your doors and get them to stop just coming to ERs. And obviously that's what these centers are designed to do. What's your outreach like? Is it easier because you are where your patients are, or do you still struggle in getting out to those patients and getting them to centers like this?
Well, I think it's both. I think that we try to locate where we think the patients will be, but also we've intentionally created an environment that has many of the services that people would have to travel to 3 or 4 different offices to get. So we have on-site a physical therapist, a dietitian, a social worker, a pharmacist to do medical management. In the traditional model, the patient sees the patient in the office, excuse me, the patient sees the doctor in the office, and then is told, we'll make an appointment with this person and that person, and we lose sight of the barriers, cost of gas, transportation for people. So we apply all this service in one area, and I think it's a time saver, and it makes sure that people get these services delivered, and it allows for coordination. I'm down the hall from the dietitian. I'm across the hall from the pharmacist.
Sure. You know, as people out there every day are the competition for picking the medical clinic and the practice that you're going to see and bring your family to, what sets DuPage Medical Group apart other than, of course, your geography and your location accessibility? Is there other things, is there an approach to care that you guys bring that might be different from other physician practices?
I think so. I think that it is a commitment to recycling the same phrase, to be where our patients are. So we have set up after-hours care from 5 p.m. till 9:30 p.m. every night. Sure. So that if the office is closed and you work downtown, we can get you in. If your children come home from school sick, we can get you in. Yeah. We're doing a nurse. We're in the process of building nurse availability for phone consultation. I think we have the programming where we look at our pediatrics department, looking at well child. Our adult medicine looks at health maintenance, as well as the care of people with chronic diseases, as well as the people with complex multiple diseases. So that continuum exists. And I guess lastly, we have this ability to communicate with our partners across the county because of a common electronic record.
Well, what you're doing is apparently working, and we continue to look forward to your continued success. Thank you for being where your patients are, and thank you for being here in Naperville. The Naperville Chamber of Commerce appreciates you as a member, and we, again, wish you all the success with the Breakthrough Care Center and everything in the future for DuPage Medical Group. Dr. Larry, thanks for being here today.
Thank you. It's a pleasure.
This is Chamber Connection. I'm your host, Mike Evans, President and CEO of the Naperville Chamber, and we'll be right back. Thank you.